Hi everyone, thank you for inviting me to give this talk on the role of artificial intelligence in spine surgery. As you know, I'm an associate professor at Columbia University in New York. I'm going to talk about how I am using artificial intelligence in spine surgery currently. You may have heard some of this, and you may hear a few of these applications from other speakers as well. Here are my disclosures, and nothing relevant to this talk really. So it's important to understand that the use of artificial intelligence in spine surgery is increasing dramatically, and it is transforming the field of spine surgery through advanced data analysis, through predictive modeling, and through robotic assistance. As you can see in that slide, the number of applications related to the use of artificial intelligence in spine surgery is also exponentially increasing over the past few years. It's important to understand the difference between artificial intelligence and machine learning. Artificial intelligence is the application of algorithms or the creation of algorithms that have the ability to solve problems that traditionally would require human intelligence. Whereas machine learning is a subset of artificial intelligence, mainly focused at data analysis, pattern recognition, and prediction. It allows the machine to learn or train with the data, with large amounts of data, and improve accuracy with increasing data inputs. Now, in my current practice, we are using various forms of artificial intelligence and algorithms to analyze patient-specific data, to create surgical plans that are patient-specific, to improve the accuracy of what we're doing, and also to reduce the operating time for some of these patients. And so here I'll start with alignment planning, and this is commercially available. This is Medtronic's platform, the Unit platform. And as you can see with these platforms now, and other companies have this similar platforms as well, you can plan a patient's alignment. You can look at their all their alignment parameters pre-op, and you can also look at the planned alignment parameters for the post-op execution of this patient's surgery. Another thing that we can see as we expand on this view is that it also gives us the predicted alignment of this patient. So you can visually see what this patient's alignment is going to look like if you choose the alignment that you have agreed on. And then lastly, you can see in the unfused segment here in the lumbar spine, you can also get a prediction of the compensation that the unfused segments will have. So it shows you how the unfused segments will respond to having this surgery in the thoracic spine. And another example of this here is this patient this one actually, where we are planning on doing a fusion of the lower lumbar spine, and we want to know how the thoracic spine would respond to that. And you can see here, as I expand on this image, I've planned my correction in the lumbar spine, and it was showing me the compensation in the thoracic spine. And now we're going to scroll down to see what the thoracic kyphosis before and predicted afterwards looks like. So it goes from 24 degrees before to about 38 degrees after the correction. That's the prediction. So this really helps us in understanding the alignment that we want to achieve for our patient and how the unfused segments would respond to what we are going to do in the fused segments. Okay, this is another useful application of artificial intelligence. This is again the one of the robotic platforms. But the key here is that you can use these platforms, which have the capability now to automatically segment the spine into separate vertebrae. And so, as I selected all these segments, it is now able to segment this into individual vertebrae, which we can then also label. And so this is all based on AI work, which can recognize the different uh, segments associated with this spine, even in the presence of deformity. And then once we have segmented things, we can obviously plan for instrumentation as well as osteotomies to help us in actually executing the plan for this patient. Now, in addition to just being able to segment or plan, uh, more and more studies are being published and more investigators are looking into this as to how they can use artificial intelligence as well as deep learning algorithms to identify key parameters and key points on x-rays and then measure these parameters automatically. So this is one example where lateral radiographs can be processed using an AI-based platform to automatically identify landmarks and then to automatically measure the different parameters for the lateral plane that we look at, which include your kyphosis, lordosis, pelvic tilt incidence, and many other parameters. And similar type of work is going on in the coronal plane, measuring scoliosis automatically through these AI-based algorithms with a good percentage of accuracy. Another thing that AI is being used for in spine surgery is to develop and propose new classifications. This was work done by the ISSG with Dr. Ames, where they looked at patients who had undergone adult spinal deformity surgery, and they classified these patients using AI-based algorithms using hierarchical clustering into 3 different types of patient profiles and 4 different types of surgical profiles to be able to then assess their outcomes. Another application of this was done by the ISSG as well in terms of classifying the cervical spine deformity into different clusters. Now, this is an exciting application that we have just started using, which is to monitor scoliosis progression as well as measuring Cobb angle just based on a patient's image. And so what this does here is that we take an image of this patient circumferentially, and then we are and as well as bending forward, and then we're able to generate a map of this patient's surface, and then using that, this is able to give us parameters as you see up here, which it gives us an estimate of this patient's cob angle, gives us an estimate of the shoulder asymmetry, as well as a trunk shift. And what really this is going to be useful for is monitoring non-surgical patients over time so that they don't have to keep on getting repeated exposure to radiation. They can simply have this app where they take a picture of themselves every few months, and it gives us an estimate of their cob angle, and we can monitor for progression. And as we see things progressing, then we can talk about or discuss what kind of interventions need to be done. So again, this is early on, but it has a huge potential to decrease radiation exposure and X-ray usage in patients. This is something I came across recently. This is an application to recognize implants that are used in orthopedics. So essentially, it can upload pictures of an implant, and then using again artificial intelligence based pattern recognition, it can give you a good estimate of what kind of implant the patient has. So for instance, if the patient has had surgery with another surgeon, and for some reason you're unable to contact them, or they were in a different country, you can use apps like this to take a picture of the implants and try to identify which implants the patient may have inside of them if you're planning a revision surgery, which could be very helpful. Outcomes predictions is an extremely powerful tool for artificial intelligence applications. Our group did this work on predicting neuromonitoring data loss during spinal deformity surgery, and we were able to come up with 8 main preoperative factors that could determine the loss of motor signals intra-op. And so you can see this was, we used this to make a scoring system. And for patients where the score pre-op was more than or equal to 8, there was a 100% chance of losing signals intra-op. So again, these type of uh, predictive tools become extremely important in, number one, assessing the risk of the surgery, and secondly, informing the patients of the risk, and thirdly, then trying to come up with backup plans to decrease the occurrence of an actual complication. Other ongoing areas of AI use for outcomes include prediction of perioperative complications, prediction of PJK, prediction of other mechanical complications, and many others that you may have come across. This is another thing that we have just started using, which is the use of a bone MRI. So it's a normal MRI scan that patients get, and then using deep learning algorithms, we can convert this normal MRI scan into a bone MRI. So the middle picture is the conversion of this MRI scan to a CT-like picture, and the third picture is an actual CT scan, and you can see how similar these two look. So that's another way of, especially for kids and young people, that's another way to decrease the amount of radiation they're getting if we need a CT scan, right? So we can get an MRI scan, use these deep learning algorithms to convert the MRI into a CT type of image to study the bone as we need to study. And more recently, we have also started using artificial intelligence-based algorithms to decrease the amount of radiation that is required for a CT scan, because these algorithms can then calibrate the amount of radiation based on the patient's size and the amount of clarity we need for these images. And so our radiology department has a few machines now that are capable of doing that. This is something I've started using for about a year now, which is an AI-based scribe service. And there are many different services that exist, so they're listed there. But essentially, what happens is, as I see a patient, I have this scribe service on my phone, which listens to the encounter between me and the patient. And then at the end of the encounter, it essentially creates a note with an HPI, with past medical history, past surgical history, physical examination, and plan based on the conversation I had, so that I can take less time writing the note afterwards. So in conclusion, as you can see, there are numerous applications of artificial intelligence in medicine and specifically in spine surgery that are already present and are expanding rapidly. There are many exciting applications of these, and I think this is going to continue to expand. And for the time being, I think this is helping us in improving patient safety, outcomes, and overall efficiency. I think the key is obviously we have to use all these different technologies in an ethical way, and we have to continuously monitor the use of these technologies. But there are a lot of potentials for the use of these technologies in just overall improving the care of our patients. So thank you very much again for inviting me to give this talk, and I appreciate the ongoing collaboration. Thank you.